Veneers are a thin covering that is permanently bonded to the outside of your tooth structure. It's used to enhance overall aesthetics. In order to determine if you're a candidate for porcelain veneers, we would start with a cosmetic consultation. We would meet together, we would look at your digital photographs that we take here in the office, as well as a 3D rendering, which is a digital impression of your teeth and gum tissue. From that, we're able to sit down and have a great chat as to what your expectations are aesthetically and what your goals are for your smile. When you finish your cosmetic consultation with me, you will have a great understanding of what the treatment timeline is, how many teeth that we need to treat to accomplish your overall goals, and also what that financial investment would be for you. Some patients end up having veneer treatment due to trauma. They may have chipped teeth over time. They may also have many worn teeth in the mouth, and this could be from grinding or clenching over time. When I'm curating an individualized treatment plan for a patient, I'm working alongside my master ceramist to design your plan in detail. Sometimes we're able to develop a treatment plan digitally, and other times we actually make a wax up by hand. This is a patient who came to me to have 10 upper veneers done, and the wax up really sort of serves as the blueprint. With the wax up design, whether it's done digitally or traditionally with wax, it's basically giving us the patient's shape, how long we want the teeth to be, the contours of the teeth, and the different anatomy that we are going to implement into their smile. Once we have the design completed, the patient will come in for their treatment. We make sure that they're very comfortable, whether they need any form of sedation. We also will make sure they're fully anesthetized so you do not feel a thing during the procedure. Then I'm shaping the teeth throughout the procedure. What I love about the porcelain veneers that I do is I'm able to stay very conservative. And by that, I mean I'm not removing a lot of tooth structure. And in some cases, I'm not even preparing the tooth. The beauty of this is we're preserving tooth structure for the rest of your life. If we are preparing the teeth and we're staying in the enamel, there is little to no risk of tooth sensitivity. And research has also shown that veneers last much longer when they're actually bonded into the enamel of the teeth. During that appointment, we also take your final impression and we will bond in your temporary veneers. The temporary veneers look incredibly lifelike. I have even had patients go to weddings with them on. I've had patients travel to Europe in temporary veneers. They've even come back to say, oh, my family member thought these were my permanent veneers. They're made from that original wax up that we talked about. So when you leave with your temporary veneers, you already have a really good idea of what you're looking at as far as shapes and design and color. What I love about the temporary phase is it's really like a smile test drive for the patient. They're in temporaries for a few weeks and it gives them a chance, after the procedure when they're not numb, to come back and see me after they've seen friends and family, they've taken selfies, and they've evaluated their smile. And during that period, we'll make any little changes that we need to, and the patient can lengthen the temporaries, shorten them, sort of change up the shapes and anatomy so that when they get their final porcelain veneers delivered, they know exactly what they're getting. When the patient comes in for their final appointment, we remove the temporary veneers, we clean the tooth structure, we bond in the permanent porcelain veneers, and we do any little bite adjustments and tweaks that we have to do. I really love cosmetic dentistry. Not only do I enjoy the artistry behind it, the design, the meticulous nature, the OCD, if you will, but I really love the effect that it has on a patient's life. Yes, there's an aesthetic boost, right? And they have a beautiful smile on the outside, but you'd be amazed at what it does for a personality and that boost in confidence that patients experience. Whether that's professional or a personal boost in confidence, it's really quite wonderful to see. When I see patients who come back after completing their veneer treatment at their recare cleaning appointment, they are just glowing. And it's really amazing that when you make that investment in yourself, that porcelain veneers can be just the ultimate game changer. My patients who have had veneers done with me always tell me, first and foremost, I wish I did this years ago, but also it's the best gift that they've given themselves.